Hi there, it's Hal Feldman, Miami Hal. It is July the 30th, the Thursday. As you can see, I have Pinecrest Mayor Joe Corradino with us. And Joe, welcome. Looks like you need a little haircut there.
Yeah,
how's it going with the hairstyling?
I don't have a hairstyle, Hal, as you can tell. So eventually when this all ends, I'll be brave enough to go back into public and get a haircut. So right now I rely on just a nice comb and some hair dye, and we're doing okay.
Hey, and also, we talked before we started the recording today. You're not in Pinecrest today, and you went north, far north, and you did it not on a plane but by car. Tell us what that experience was like real quickly, and why you did a plane or a car versus a plane.
Hal, I'm sending my daughter off to college, and she has been gone all summer, and if we didn't see her, there was going to be hell to pay. So, we had a lovely 20-hour drive from Miami to Cape May, New Jersey, where we'll be spending a couple of days. It's pleasant. It's hot, but it's not humid, and we get to put the family together, and it's a great feeling. So, we're having fun.
I got it. Great. Well, more importantly, last week we were in a situation and a conversation where it really felt like if we didn't get our act together in 7 days, that you were concerned there was some real consequences that we were going to have. And that's exactly what you told us. But now we're 7 days past that last conversation. So please share with us what you've learned and what your feelings are today.
Yeah, we're still suffering some severe consequences of this disease. There's 3,000 people in the hospital. But what we learned this week is like the medical people projected, the disease hit a crest, it's plateaued, and it started ever so slightly to recede. And so if this keeps up, which is not a guarantee, we'll be able to avoid the nightmare scenario. And so thus far, because of the hospital metering, no elective surgeries, the addition of other nurses from other parts of the state and out of state, nobody's died because they haven't been able to get a bed, a ventilator, or critical care. That's what we're trying to avoid. The hospitals are still packed, well over any acceptable number, and it's starting to go down ever so slightly. Even the testing is still testing at 18% positivity rate, which is way too high. We need to be around 5%. We're still admitting people to the hospital, but they're going down. We have 100 less people in the hospital today than we did last week at this time. So that's good, but it's not great. The unfortunate thing is those people that are in the hospital now are very, very sick. One hospital system suggests that 90% of its beds, its ICU beds, have people on ventilators in them. And the outcomes for people on ventilators are horrible, 60% mortality rate. So those deaths lag behind all the early indicators. We won't see, you're going to see on the news an extraordinary amount of deaths that's just baked in, and that's going to be coming in the next several weeks. So it's not going to look good.
Yeah, that's never pretty when you look at numbers that don't paint us in a great light. Something that occurred to me yesterday, I happened to be crossing on the 826 heading into the downtown area, and there was a sign that said medical center exit, and the same exit sign also said Marlin Stadium. And it just struck me as a little bit funny, as you might imagine, medical center or medical area and the Marlins. So how do you think that's painting us in the light across the country, across the world? And do we earn that particular viewpoint at this point in time?
How we look terrible. We're the epicenter of the country. We opened up, and we opened up smartly. We had passed CDC gateway criteria. We had plenty of rules, and a significant amount of the population decided not to pay attention to the rules. And now we've got thousands of people in the hospital, over 1,400 deaths or something like that, right? We look terrible. And so this has got to go away. It's got to recede. We've got to get down to baseline. And then we need to behave ourselves, because if we don't, think about when kids go back to school in person in October. Think about the Thanksgiving and the holidays, and we cannot, right, emotionally, mentally, financially, economically, and health-wise, be back in this situation again. people need to wear the masks. We can't be here again. This is terrible.
So you brought up my next point, which is now there's a decision on how Miami-Dade schools are going to be operating. They will be starting late, and they will be starting completely online with a review and a reassessment as to whether or not they'll ever get back to, in-class teaching about a month later. So, how does that affect the folks of Pinecrest and the surrounding areas? And what are your thoughts on, obviously the fact is the fact. There is nothing but online school. But how is that going to affect traffic in the area, people's ability to go to work? What are your thoughts there? And how are the mayors of the area trying to address that?
We all want to get back to normal. We all want our kids to go to school. You can't send your kids to school when we're testing 18 and 20% positivity rate. It's impossible. It's a nightmare. So, you know what it is? The blunt fact is, if you want to get back to normal, wear a mask. It's that simple. If you're not, the fastest way to get back to normal is wear your mask, right? Wash your hands. We know what to do. We did it already, and it worked. Look, the young people got to pay attention too. I mean, they don't believe that this impacts them. They're totally wrong on that. They need to wear their masks. They need to stay home, stay out of big social gatherings. And until that happens, there's not going to be a normal.
Got it. Yeah. I'm going to stop that call from making noise. Just 1 second. Okay. And so is there anything else that we need to know? Because as you're aware, we're getting bombarded all different types of media, some of which is not 100% based in fact. And I think people get confused. So tell us what your thoughts are on where people should be going to get the latest information and truly facts rather than things that are hyperbole.
I think the news media is covering this relatively accurately, at least the local news is anyway. I think their coverage lags a little bit behind. I think there's a lot of facts out there. Look, the situation's not good. It's improving and it's getting better. Let me update you on one thing that I think is critically important, and it's a little bit troubling. The coordination between the cities and the county had been working very well, unprecedented, as we started to look at policy and reacting to this disease that was coming at us. It started to break down this week when we started to distribute some money. The federal government, through the Coronavirus Relief Act, gave Miami-Dade County $474 million. Right, this money was intended to be spread to the local governments, basically in an equitable manner. So we've been negotiating with Miami-Dade County. Miami-Dade County, in the cities in Miami-Dade County, represent 57% of the population in Miami-Dade County. The county decided to distribute 94% of the dollars to Miami-Dade County, giving cities 6%, which is a complete inequitable distribution of these funds.
Sure sounds like it.
Sure sounds like it, right? So this is not fair, and we'll be fighting with Miami-Dade County in a respectful manner to make sure that we get a more equitable distribution of funds. But it's really funny to me how this can happen, right? We've been asking Miami-Dade County for 25 years to help get us, Pinecrest, our 700 homes without water onto the Miami-Dade County water system. They won't help us. We've been asking the county to help us get our thousands of people off septic tanks onto their sewer system. That won't happen. They built a fire station because they had a lack of a level of service down on Old Cutler Road. They can't put a rescue truck in it, right? They've done nothing we've asked them to do in the last 25 years. They can't enforce their own rules. They can't get permits out. But now, when it comes to spending $500 million, the county commission thinks it can spend the money better than the village of Pinecrest. It's a travesty. And we're not going to allow it to happen. We're going to make sure that we get reimbursed for everything we've spent and make sure that distribution is equitable. But that's what happened this week. Those are just the facts. And unfortunately, this is not the right time to be squabbling and fighting. But it is Miami-Dade County, and that's where we are. We're gonna do it, and we'll do it collegially, and we'll get the job. We'll come together.
It sounds like after you see your daughter off to college, you have a lot of work ahead of you, and you're already mindful of what you need to do. And sounds like at least peacefully, you're going to find a way to get it done for us. That's great.
Yeah, we're going to get it done.
Last thing, any words on what may be a tropical storm in the area and how people should react to that? Because, it's potentially, and I don't want to scare anybody, it's potentially obviously a double whammy. We were already, with COVID-19 and all the restrictions and things we're trying to do to work on that. And now we've got potentially you'll go get water and gas and all those other things that we do to prepare for storms.
Finally, Hal, a problem we can deal with. This is a day at the beach. So what? With tropical storm, we know how to deal with it. We've done it for generations in South Florida and Miami-Dade County. We all know what to do. All the thing I can say, look, as usual, they can't predict this thing. The best place you can be 5 days away from any of these storms is right dead in the middle of that cone. So just prepare, shutters. I suggest preparing early this year because everything's kind of crazy. The fact of the matter is that this is a good warm up too, because this looks like a tropical storm, and we're going to be in contact with FP&L should any widespread power outages happen. We've been working with those guys for years to make sure that they're in the community the day after, not like the last time where they weren't in the community for a couple of years. We rebuilt our relationships with those guys so that it'll work out well. The emergency management people at Miami-Dade County have done an excellent job of figuring out how to evacuate, how to shelter, all with distance separation. So there's many more shelters than there were in previous years, all in anticipation of having to put people further apart. So again, we're prepared. We know how to do this in South Florida. I'm usually more troubled about the aftermath of these things than the actual storms, because electricity goes out and those types of things. But just be prepared. It reminds us that there's about 6 weeks before the peak of hurricane season, and God forbid we really have to go through that. But finally, a problem we know how to deal with.
Pinecrest Mayor Joe Corradino, we thank you and salute you and the entire team in Pinecrest that's working for us. We know that they're out there. If you want to give a quick shout out, and then I'll make sure to send you some hair shears, okay?
Yeah,
we'll get you
absolutely.
cut up a little bit nicer.
I have the dog clippers. I just hadn't used them today. No, I want to thank the staff, village manager, the village clerk, all the directors in Pinecrest. They're working their tails off, and I want to thank our village council. Every one of the people on the village council are dedicated. They're working every day. They're doing double, triple time, answering phone calls and emails in real time, right? Nothing gets by them. It's all answered almost immediately, and they're doing great work, and every one of them are all-stars. And so I want to thank them. And if anybody needs me, 305-606-2364, we're always here, and we'll help you get through this as painlessly as possible.
We're getting the word out, Joe. Thanks so much for your time. And
good work, sir.
Congrats to your daughter.
Yeah, thanks, man. We'll see you.
Okay, let me stop the recording there. I think we're good. Have a good one, Joe.
All right, man. Enjoy. Let me know if you need anything.